I am a doctor, but I am not your doctor, and what you are about to hear is for educational purposes only, not personal medical advice. My name is Dr. James Miller, and for over 20 years I have worked with people in their 60s, 70s, and 80s who all describe the same strange afternoon feeling. Heavy legs, weak knees, a tiredness that seems to come out of nowhere around 3 o'clock, even though the morning felt completely fine. If that sounds familiar, stay with me, because what is actually happening inside your legs right now is probably not what you have been told, and understanding it properly could change how you think about your own afternoons going forward. Before we go any further, I want to be honest with you, because that matters more to me than getting views. Heavy, weak legs in the afternoon can have several different causes, and not all of them are simple. Conditions like venous insufficiency, where blood pools in the lower legs because the valves inside your veins are not working as efficiently as they once did. Peripheral artery disease, where narrowed arteries restrict blood flow to the muscles. Diabetes-related nerve changes, sometimes called peripheral neuropathy. Heart-related fluid retention, where the heart struggles to pump efficiently and fluid backs up into the legs. And even vitamin B12 deficiency, which can affect nerve function in ways that mimic muscle fatigue, can all produce this exact same heavy, weak sensation. These conditions are common enough and important enough that I would be doing you a disservice if I rushed past them just to get to today's main topic. If your legs are swelling, changing color, becoming numb, or if this heaviness comes on suddenly or only on one side, please do not wait for the rest of this video. Please contact your doctor, ideally the same day. What I'm going to walk you through today is one common, often overlooked contributing factor that I have seen show up again and again in patients once those more serious causes have been ruled out by a physician. It is not the only possible explanation. It is not a replacement for a proper medical evaluation. But for a great many people, once the more urgent possibilities have been addressed, it may be one important piece of the puzzle that gets surprisingly little attention. So let's talk about what is happening, in plain language, inside a leg that feels heavy every single afternoon. Think of every muscle fiber in your thigh and calf as a tiny electrical wire, working alongside thousands of others, all coordinated to let you walk, stand, and rise from a chair. For that wire to do its job, there is a careful exchange of minerals happening at the cellular level. Sodium moves in, potassium moves out, calcium triggers the actual contraction, the squeeze, and magnesium plays a key supporting role in allowing that muscle fiber to relax again afterward. This is well-established physiology, and it is one reason magnesium is often discussed in conversations about muscle function and nerve signaling. Neurologists have long described magnesium as playing an important role in regulating how excitable our nerves are. When magnesium levels run low, nerve cells can become more easily triggered, which may contribute to muscles feeling more fatigued with less effort than usual. Cardiologists, from a different angle, often point out that magnesium also plays a role in helping blood vessels relax and widen, a process called vasodilation. If magnesium is insufficient, blood vessels, including those supplying the legs, may stay slightly more constricted than ideal, which could mean somewhat reduced blood flow to the muscles that need it most during an active day. I want to be careful here and say this clearly. Magnesium is not the only mineral involved, and a deficiency is not confirmed just because your legs feel heavy. But it is one well-documented contributor that is rarely discussed with patients during a typical short appointment. It is worth noting that potassium and calcium imbalances can produce overlapping symptoms as well, which is part of why a simple blood test ordered by your physician can be so useful, since it can clarify which minerals, if any, are genuinely low, rather than leaving you to guess based on symptoms alone. There are a few reasons magnesium tends to become a more relevant concern as we age. Many older adults absorb nutrients somewhat less efficiently than they did decades earlier, which is a normal part of digestive aging rather than anything alarming. In addition, several very common medications can influence magnesium levels. Diuretics, often prescribed for blood pressure or fluid retention, can increase how much magnesium the kidneys release. Certain medications used for acid reflux have also been associated, in medical literature, with lower magnesium absorption over time. None of this means these medications are wrong for you. Your doctor has prescribed them for important reasons. It simply means that, if you are on these medications, it may be worth discussing your magnesium intake at your next appointment, particularly if you are also dealing with unexplained muscle fatigue. It also helps to understand what magnesium is doing at a slightly deeper level, because this isn't just about one isolated muscle twitch here or there. Inside every muscle cell, there is a constant rhythmic cycle of contraction and relaxation happening throughout the day, even during simple activities like standing at the kitchen counter or walking across a room. Each one of those tiny relaxation phases depends on calcium being pumped back out of the muscle cell efficiently, and magnesium is one of the key minerals that helps power that pump. When magnesium is running low, that pump can become less efficient, meaning calcium lingers a little longer inside the cell than it ideally should. The muscle technically still relaxes, but perhaps not quite as completely and not quite as quickly. Multiply that tiny inefficiency across thousands of contractions over the course of a day, and by mid-afternoon, many people experience this as a generalized heaviness or fatigue, rather than as a single dramatic moment of weakness. This is one plausible mechanism that researchers and clinicians have pointed to, though I want to be clear that muscle fatigue is a complex, multifactorial process, and magnesium status is one piece of a larger picture that can also include hydration, overall fitness, sleep quality, and underlying medical conditions we already discussed. Now, why does this heaviness seem to show up specifically in the afternoon rather than first thing in the morning? There is a reasonable physiological explanation here as well, and understanding it can make the pattern feel far less mysterious and far less worrying. After lunch, your body redirects energy toward digestion, and cortisol, your primary stress hormone, naturally experiences a smaller secondary rise later in the day. For someone whose magnesium reserves are already running on the lower side, this midday window can be when muscle fatigue becomes most noticeable, simply because the body's available resources for full muscle relaxation are already being stretched thin. I want to emphasize, this is a plausible contributing pattern, not a guaranteed explanation for every single person experiencing this symptom. It is also worth understanding why some common attempts to fix this feeling do not seem to help much. Many people, once they suspect something is off, simply try drinking more plain water, assuming dehydration is the issue. Staying hydrated genuinely matters for circulation and overall health, but water alone does not address a mineral imbalance, and in some cases, drinking large amounts of plain water without adequate electrolytes can even dilute the minerals your muscles depend on. Others try gentle stretching, which can feel pleasant and may help temporarily, but does not address an underlying mineral shortfall if one is present. Compression stockings, often recommended for circulation concerns, can also be genuinely helpful for some of the conditions we mentioned earlier, but again, they do not address a mineral-related contributor on their own. Urologists have also noted that magnesium plays a role in regulating smooth muscle elsewhere in the body, including the bladder and certain blood vessel walls, which may help explain why some people notice several seemingly unrelated symptoms together, such as occasional nighttime leg cramps, restless legs while trying to fall asleep, and afternoon heaviness. These patterns do not prove a magnesium issue on their own, but taken together, they are often worth mentioning to your physician, particularly because describing the full pattern, rather than just one isolated symptom, tends to give your doctor a much clearer picture to work with. So, what can you actually do about this starting today in a way that is simple, inexpensive, and grounded in reasonable nutritional science? I want to walk you through a daily approach using ordinary foods that many nutrition guidelines already recognize as good natural sources of magnesium, alongside one evening ritual that supports circulation through a mechanism we can speak about with confidence. In the morning, consider including a small serving of raw pumpkin seeds, roughly 1 tablespoon, as part of your breakfast routine, or alongside your morning tea. Pumpkin seeds are widely recognized as one of the more magnesium-dense common foods available, and a small daily serving is a reasonable low-risk way to support overall mineral intake. Other reasonable morning options include almonds or sunflower seeds, both of which contain meaningful amounts of magnesium and can simply be rotated in if you want some variety from week to week. Pairing this with a glass of water, comfortably warm rather than ice cold, may be gentler on the stomach for some people, though this is more a matter of personal comfort than a strict requirement. At lunchtime, consider adding a modest serving of white beans, about half a cup, to your meal. White beans are another well-recognized source of dietary magnesium, and they also contain fiber, which supports healthy digestion more broadly and may help regulate how quickly nutrients move through your digestive tract. Other legumes, such as black beans or chickpeas, offer similar benefits if you prefer variety throughout the week, so you are not limited to just one option if your taste or your grocery budget calls for something different. Alongside this, a serving of cooked rather than raw spinach can be a sensible addition. Cooking spinach helps reduce compounds called oxalates, which can otherwise interfere with how efficiently certain minerals, including magnesium, are absorbed in the gut. If spinach is not to your taste, other cooked leafy greens, such as Swiss chard or kale, are reasonable substitutes that follow this same general principle. This is a small, evidence-informed adjustment, not a dramatic intervention, but small adjustments, made consistently, are often what produce real change over time. In the evening, roughly an hour before bed, consider a warm foot soak using about 2 tablespoons of plain Epsom salt dissolved in comfortably warm water for around 15 minutes. I want to be transparent with you about this step, because intellectual honesty matters to me. Whether magnesium from Epsom salt is meaningfully absorbed through the skin remains a genuinely debated question among researchers, and I am not going to tell you it is a proven method of raising your magnesium levels, because that would not be accurate. What is much better supported is this: the warmth of the water itself encourages increased blood flow to the lower legs, which may help support the clearance of metabolic byproducts that can accumulate in muscles after a long day of use. While your feet are soaking, you can gently massage each calf in slow upward strokes, from ankle toward knee, for about 2 minutes per leg. This combination of warmth and gentle massage is a reasonable, low-risk way to support circulation and may contribute to a feeling of relief in tired, heavy legs, independent of any mineral absorption question. Some patients also find this routine genuinely calming before bed, which is worth mentioning, because stress and poor sleep can themselves contribute to how heavy and fatigued your legs feel the following afternoon. A body that is well rested and less stressed tends to manage its mineral and energy resources somewhat more efficiently throughout the day. So this evening ritual may be offering you a quiet benefit on more than one level at once. If you would like to try this approach, I would suggest committing to it consistently for around 2 weeks, paying attention to how your legs feel during that familiar afternoon window, perhaps even keeping a brief daily note of how heavy or light your legs felt, since small patterns are often easier to notice in writing than in memory alone. Some people notice a difference within the first several days. For others, change may take longer or may be more modest, and that is completely normal because every body is different, and magnesium is very likely one factor among several at play. I want to be careful not to promise you a specific outcome, because that would not be honest medicine. What I can tell you is that these foods and this evening ritual are inexpensive, low risk for most people, and grounded in reasonable, well-established nutritional principles, which makes this a sensible thing to try while also continuing any care your physician has already recommended. I think of a patient I worked with some years ago, a retired school teacher in her early 70s, who described almost exactly the pattern we have been discussing. Fine in the morning, increasingly heavy and unsteady by mid-afternoon, to the point where she had quietly stopped attending her weekly walking group, telling her friends she was just tired, rather than admitting how worried she actually was. We first made sure, together with her cardiologist, that her heart and circulation were healthy, and that there were no signs of something more serious, which gave both of us real peace of mind before moving forward. Once that was confirmed, we talked through her diet and her medications and noticed she had been on a diuretic for several years with very little magnesium-rich food in her typical week. She began incorporating simple changes along these same lines. Nothing dramatic, just consistent small adjustments to her meals and a calming evening routine. Over the following weeks, she told me her afternoons felt noticeably more manageable, and she eventually returned to her walking group, even bringing along a friend who had been struggling with something similar. I share this not as proof that this will work the same way for everyone, because every person and every body is different, but as an honest example of how a small, sensible adjustment, made consistently, can sometimes make a meaningful difference once more. Serious causes have been responsibly ruled out. I want to leave you with something important before we close. If your legs have felt heavy and weak this past while, please do not assume that this is simply an unavoidable part of getting older that you must quietly accept. Many people carry that belief for years, and it can quietly shrink their world. Fewer walks, fewer outings, fewer afternoons spent doing the things they love, simply because they assumed nothing could be done. At the same time, Please do not assume that one mineral or one simple kitchen ritual is automatically the entire answer either. Real health, especially as we get older, rarely comes down to a single dramatic fix. It comes from a combination of good medical care, sensible daily habits, and an honest, ongoing relationship with your own doctor, someone who can look at your full picture over time. The most responsible path forward is the one that combines small, sensible daily habits like the ones we discussed today, with an honest conversation with your own doctor, especially if this heaviness is new, worsening, occurring only on one side, or accompanied by swelling, color changes, numbness, chest discomfort, or shortness of breath. Those particular signs deserve prompt medical attention, not a home remedy, and no video, including this one, should ever be the final word on a concerning symptom. Please remember, everything I have shared today is general educational information, not a personalized medical recommendation for your specific situation. Before making any changes to your diet, your supplements, or your daily routine, especially if you are managing diabetes, heart disease, kidney issues, or taking medications such as diuretics, blood thinners, or treatments for blood pressure, please speak with your physician first so that any new habit fits safely alongside the care you are already receiving. This is especially true if you are considering a magnesium supplement in pill form, rather than the food-based approach we discussed today, because supplemental magnesium can interact with certain medications and may not be appropriate for people with reduced kidney function. Food-based sources, eaten in normal, modest amounts, are generally considered a gentler starting point for most people, but your doctor is still the right person to confirm that this approach makes sense given your particular health history. Your doctor knows your full medical history in a way that no video ever can, and that conversation is genuinely worth having, even if it only takes a few minutes at your next visit. Now, before you go, let me ask you something else many of my patients quietly wonder about, but rarely bring up at their appointments. Have you noticed yourself waking up 2, 3, sometimes even 4 times every single night just to use the bathroom? Many people simply assume this is their bladder slowly wearing out with age, something to be tolerated rather than understood. But there is more nuance to that story than most people realize, including a few everyday evening habits that may be quietly making those nighttime trips more frequent than they need to be. In our next conversation together, I want to walk you through exactly what tends to be happening and what is genuinely worth discussing with your own doctor. I will see you there.